Welcome back. In case you're just joining us, you are right in time for the conversation that we are going to have, the cost of healthcare with specific attention to cancer. So allow me to just reintroduce my panel again. Sit closer to me on this side, Dr. Alfred Karagu. He is the CEO of the National Cancer Institute. We also have with that Gilbert Osoro, the claims manager at NHIF, and David Makumi, who is the vice chairman for NCD, that's Non-Communicable Diseases Alliance of Kenya, and also the outgoing chairman for the Kenyan Network of Cancer Organizations, and someone whose story is just about to inspire in just a few minutes, Sally Kwenda. She is a cancer warrior. Thank you so much, all of you, for your time here this morning. Dr. Alfred, let me begin with you. The most obvious question: why have we seen a rapid rise of cancer in Kenya?
I think it's multiplicity of factors. One, generally, globally, I mean, all across the world, the cancer burden has been going up. So I think Kenya is just within that larger global increase in cancer cases. Globally, that has been attributed to changing lifestyles. So there are a number of lifestyle-related factors that will contribute to cancer. The major one is tobacco use. Worldwide, tobacco use is estimated to account for about 22% of all cancer cases, which is also quite a big problem in this country. I think the last national survey that we did about 2-3 years ago showed that particularly in men, about 23% of adult men smoke. So that speaks to quite a huge burden of tobacco use in this country. And so there's the element of risk factors like tobacco, alcohol use, diet, highly processed diet, and issues of lack of physical activity. But we also need to appreciate that where we are coming from in the African setup, infection is also a major contribution. In this case, we're talking about cervical cancer and the human papilloma virus, which contributes to the cervical cancer. That contributes quite a bit of our burden in sub-Saharan Africa. Other infections like we still, although we have made quite some significant gains in HIV control, there are also some cancers that are related to HIV, which is a burden in this country. So issues like cancers like what you call Kaposi sarcoma, some lymphomas, cervical cancer as well. So I would say generally we share the burden of the risk factors just like the rest of the world does. Okay. But also, I think the other thing that we hypothesize that may have contributed to the rising number of cases is we have also improved our capacity to detect these cancers. So previously, where maybe people may not have had access to diagnostic services, that has changed over the past 5-10 years. So I would say it's a combination of probably better detection right now, because of even a bit more better awareness, but also because of the risk factors that fuel the burden of cancer globally. Right,
David, I want to hear your thoughts on this, on why cancer has become so popular within our society, and the fact that you are the vice chairman for NCD, Non-Communicable Disease Alliance of Kenya. I just want you to add on to that. Dr. has also just told us, like HIV, HIV is linked to some cancers.
Yes.
To some. Just jump on that story.
Yes, exactly what he has said in terms of them. As our society, we are so-called becoming middle class, middle income country. As our country develops and we start adopting certain lifestyles that were hitherto the preserve of the West, we definitely will see an increase in non-communicable diseases. And one of the things with the cancers, it shares some of those risk factors with other non-communicable diseases. So when you take things like obesity, we have a crisis of obesity in a country that is also facing starvation. So obesity is a major risk factor, not just for cancer, but for heart diseases, for diabetes. All these other issues around industrial pollution. exposure to certain chemicals. So, you know, if you go to industrial area here, some of our workers are handling some chemicals like benzene, which is a known risk factor, without adequate protection. So exposure to pollution is also a major risk factor. Actually, WHO added among the major risk factors, tobacco, diet, alcohol. They actually have added air pollution as a major risk factor, not just for cancer, but also for a number of other respiratory diseases. So pollution is a big issue. It is actually been recognized now by WHO, and that goes for the pollution that we are seeing in our rivers, where industries are draining their effluent, you know, laden with very heavy metals, and people downstream are drinking the same water. So it's a major, there are a number of factors, a combination of them. We also know that about 10% or thereabout of some of the cancers, not all cancers, also do have a genetic link. There are a few cancers, like 10% of breast cancers, about 10% of colon cancer. So you have a very strong family kind of a link, but that is just 10%. So for majority, there are risk factors, but also there are patients or people who get cancer without any of those risk factors being present, because we know cancer is a disease of cells. So there are people who will not have any risk factors and they still develop cancer. So we would not be able to, we should actually not blame a patient or try to figure out, so why did I get, I don't drink, I don't smoke, I'm not exposed to pollution, I exercise, I eat right. You can still get cancer, so that's important.
And David, you know, in this financial budget for this year that Rotich read, the sin tax is what we call it, the drinking and the tobacco have gone up higher. Do you think Kenyans will reduce that intake and perhaps be more sensitive with their health?
We need to tax those sins and tax them heavily to the wall, but also combine that with adequate public health messaging, so that it's not just that alcohol has become very expensive. Kenyans need to know alcohol is a group 1 carcinogen. It is there listed by WHO. So we need to combine that so that they know I'm not stopping or reducing alcohol because it's expensive. I'm reducing my intake of alcohol because it is a risk factor for major non-communicable diseases. So this has to be combined with public health messaging. You see, I want to live to see a day when the bottle of alcohol, whichever brand or make, has that warning that says this product can cause cancer, not just like it is harmful to your health. That's very ambiguous and broad.
So if you feel like if the messages were streamlined,
like the way we've done with the tobacco.
Yes.
So we need to combine those public health messaging with increasing the taxes. So people make a conscious decision to drink or not to drink, or to smoke or not to smoke, based on their health. Should be a health choice.
So here on Daybreak, we always love your feedback. We appreciate your comments, your call-ins, your tweets, and your SMSs. 22422, that's our SMS line. Our Twitter handle @Citizen TV Kenya, #Daybreak. That's your ticket into the conversation. But here's what we are asking you this morning. What more? What should the government do to reduce the cost of cancer treatment? There you go. What should the government do to reduce the cost of treatment? Remember, #Daybreak, 22422 is our SMS line. If the 140 characters won't do for you, you can even call in, share your story, ask a question, 0719 777 or 0742 961 343. So, Sally, I personally know your story. We're going to get to your story just a bit so you can share with Kenyans, and hopefully they'll leave feeling a bit inspired. But, Gilbert, let me come to you. Why is cancer treatment so expensive in Kenya? What is it about cancer that makes it so expensive?
Thank you, Zinzi. First of all, equipment to diagnose and treat cancer are very expensive to procure. It has taken us over 50 years for us to get a PET CT scan that was launched the other day in Aga Khan Hospital.
50 years?
Yeah, 50 years. You remember in the recent past, many Kenyans were traveling to India for purposes of getting services of a PET CT scan. But thank God, Aga Khan University Hospital has invested in a PET CT scan. We are talking of radiotherapy equipment, and we are talking of things like the latest equipment in town, the Halcyon equipment, which cost in excess of $250 million US. To invest in that doesn't come easy. And you will note that if you look across the country, you will realize that it's only in KNH whereby Kenyans can be able to access radiotherapy treatment. Across others, in private healthcare facilities, it's in very few facilities that have invested in cancer equipment. And as such, it makes equipment very expensive.
So one, the cost of equipment.
The other thing, personnel. We have very few doctors, oncologists in this country. And as such, accessing them requires that you either come to the urban areas, either in Nairobi, Eldoret, or Mombasa. And as such, seeing doctors is also quite expensive. Leave alone that the medication, many of the medication that cancer patients require
is expensive.
It is sold by pharmaceutical giants. We are talking of companies like Novartis, Glaxo, and others. And
why
they've
is it
put a lot of money in research, which they need to recoup, making medication quite expensive. There's been a debate that in other jurisdictions, whereby, like in India, whereby they've licensed generic producers of drugs, but in other countries it's also a bit difficult, and I thank God the government allowed generics to be sold in this market. Otherwise, the cost of cancer treatment could be very expensive.
Well, you get to hear it firsthand from our cancer survivor who is seated right here. But let's just pick it up from there that Gilbert has talked about infrastructure. Earlier on this week here on Daybreak, on Tuesday to be more specific, we had the CS of Health, Cecily Kariuki, who was speaking to our very own Sam Gituku. Here is what she had to say on that issue of infrastructure.
We are also looking at investment in terms of infrastructure, additional infrastructural support. We have, in the last 2 years, put up 9 chemotherapy centers, across the country. Right now, we are putting up radiotherapy centers, 4 of them. We are calling them the Centers of Excellence, and are in the process of being constructed, as it were. We have secured the budgets to also be able to equip this within this year. We also note that the KU, Teaching and Referral Hospital, will be opening up its doors as a referral hospital that is high-end at level 6 in the coming few months. Again, it has or comes along with the specialized care for cancer patients. Of course, Moi Referral and Kenyatta Referral continue to give care, as it were, but as you can imagine from the numbers I've shared with you, the capacities are completely stretched. We have seen also in the private sector, especially the Aga Khan, invest in a cancer treatment, including investing in the PET scan.
All right, so you've heard from Cecily Kariuki there, the CS of Health. So we have a budget secured, which will also go into building centers of excellence within this same year, and 9 chemotherapy. Dr. Alfred, is it therapy centers? Is this true? Because you deal with this on a day-to-day basis. As a doctor, has infrastructure improved, thus making your work easier and treatment for cancer victims?
It's true, and I just want to reiterate what our Cabinet Secretary mentioned 2 days ago. I wanted to weigh in to relate that to the cost of treatment. I think why the cost of treatment has been a major issue in this country is more or less the economic issue of demand and supply. There is huge demand, and yet the supply has been fairly limited, particularly in the public sector. I think that's why, as government, we have come in to enhance access across the public sector. I'll give you an example. About 3, 4, 5 years ago, the cost of radiotherapy in this country was, at Kenyatta National Hospital, a session would set back a patient 500 shillings. Whereas in the private sector in this town, one would be required to contribute upward almost to about 10,000 Kenya shillings per session. So I know Gilbert will talk about this. When NHIF stepped in to cushion the cost of care, allowing patients to even be able to access, to be able to pay for that access in the private sector, that had a knockdown effect even on the Kenyatta National Hospital itself, because from a waiting period of close to 1.5 to 2 years, patients waiting for radiotherapy treatment, we saw that come down to just about 2 months currently. So I think the deliberate investment by government to spread this outside Nairobi to Moi Teaching and Referral Hospital, to the 4 regional centers of excellence that our cabinet secretary talked about. That's a deliberate effort to make sure that we supply more of the service, and that has a knockdown effect on the pricing.
Right.
The same for the cost of medicine. Over the past 1 year, we have actually seen KEMSA, which is the National Drug Supplies Agency under the Ministry of Health, embark on bulk procurement of cancer medicines. Mm-hmm. Because for sure, over the past, cancer medicines we have depended on pharmaceuticals or local suppliers who's operating on very small volumes. So hence, understandably, their prices would have to be high. But I think as we increase this investment, infrastructure investment, and as we improve, we look at it holistically at national level so that we have volumes, bulk purchases of medicines, of supplies, of equipment that are required for cancer care. We'll progressively see the cost of care coming down.
So Gilbert, let me rope you into the conversation. As the claims manager for NHIF, does NHIF cover all cancer patients and cover them fully? So whether someone comes in with cervical cancer, prostate cancer, blood cancer, etc., whatever cancer it is, does NHIF cover that fully for cancer patients?
Thank you, Zizi. Yes, NHIF covers cancer patients comprehensively. One thing I want to tell Kenyans, and I'll quote from the scriptures, is that my people perish because of lack of sufficient knowledge. We do cover cancer treatment under the oncology package. I want to tell Kenyans that currently NHIF administers around about 13 benefit package, which includes, among others, the inpatient, outpatient, surgical, kidney transplantation, dialysis, emergency evacuation, and including the oncology package, which I want to share with you extensively. Under the oncology package, we do cover the following: chemotherapy.
For how many sessions?
I'll go to the details. Radiotherapy. And brachytherapy, which is among the latest technologies in town. Under chemotherapy, NHIF is obliged to cover for first-line chemo. We do pay up to 25,000 shillings for a session, and we are obliged to cover up to a maximum of 6 sessions, translating to 150,000. Under second line, or what we call complex cancer, NHIF is obliged to cover up to Kenya shillings 150 and up to 4 sessions, translating to Kenya shillings 600,000. If you look at the cumulative figure, for the chemo alone, we cover in excess of 750,000, which is adequate to cover for treatment. But as I mentioned earlier when we began the show, cancer treatment is covered in other packages. We are talking of oncosurgery, whereby we do cover for oncology, surgical procedures and oncology. And depending on the service level of the facility and the contract type, we do pay comprehensively. Under the radiology package, which has among others the MRI, CT scan, ultrasound, and the latest kid on the block, that is the PET CT scan, which was launched in Aga Khan, we do cover comprehensively. For example, for purposes of diagnostic imaging, for the PET CT scan at Aga Khan Hospital, National Hospital Insurance Fund is obliged to pay Kenya shillings 69,500 per family per card for purposes of diagnostic imaging. We also do pay for the MRI for purposes of staging, whereby we pay up to 15,000. For radiotherapy, and in this matter, of late there's been a rapid improvement in radiotherapy in this country. We are talking of the latest technology, which is the IMATI, Image Modulated Radiotherapy Treatment, which is offered in cancer care. We do.
So Gilbert, what happens now if you come in with also with a non-communicable disease? If now a patient also has diabetes, cardiovascular disease, HIV, does the cover still cover that as well, or now that's a different conversation?
We do cover for comorbidities. That is patients who ail from more than one illness. So long as you are fully paid up member of NHIF, we do cover that. It's either under the surgical package, you can be covered under the renal dialysis package, whereby NHIF is obliged to pay 9,500 shillings per session, and we pay for 2 sessions in a week, or 76,000 in a month. That is 8 sessions. For any other ailment, it's covered under inpatient treatment, under the 13 packages that I mentioned that NHF administers. Yeah.
All right, so I've purposely held on Sally just a little bit because after the commercial break, I want you to hear her story and hear her journey. But before we do that, let's take a look at your feedback on SMS and on Twitter as well. 22422, that's our SMS line. Lazaro on Twitter, good morning to you. You say, of recent, cancer has dethroned HIV and AIDS as the number one killer disease in Africa. We are appealing for rapid response from the developed nations and the way the way they respond to HIV and AIDS. That's Lazaro's thoughts on Twitter. Hashtag Daybreak is a ticket into the conversation. The cost of healthcare is what we're discussing about. So, Sir Kyoko, you say the Kenyan government should invest in working equipment and skilled human resources to offer detection and treatment on times across all regions. People sensitization is also key so that we learn how to offer support systems to patients. On SMS 22422, that's another avenue that you can use to send in your feedback. All right, so Gladys, good morning to you. You say, hi Daybreak, hi. To reduce this cancer in Kenya, let the government make collaborations with the prominent herbal doctors they are ignoring, but they can. All right, and yes, that's a point we will have to be discussing. Dr. Alfred will be discussing the issue of herbal, cannabis as an option, and etc. Welcome back. Thank you so much for sticking with Daybreak. As promised, let's hear Sally's story. So Sally, walk me through this. Take me through it. The first time a doctor told you, Sally, you have cancer, what's the first thing that came to your mind?
That was in 2007. And cancer wasn't talked much about that time. So for me, it was death. Yes.
That's the first thing that came to your mind?
Yes.
How did you break the story to your loved ones?
Even before breaking the story to my loved one, how the doctor broke the story to me. I mean, he just said, you have stage 2 cervical cancer. And we have to do total hysterectomy. And you know, I'd lost 2 babies. So I was expecting that maybe he would prepare me and take me through the journey. But he just said, we have to go to theater because you are at risk of this spreading. So even before I went home to break this news, it was already too heavy on me. Actually, I took a lot of time to tell it to my sister. I'd lost my parents, so I have a sister who doubles up as a mother. She lived with me since my parents passed on. So I took almost a week before telling her, because she's hypertensive, and I thought if I tell her this, it will break her heart. So first I went to my employer. I was privileged to be working with a medical organization, so I explained to them what the doctor said, and they said, I also have HIV, and they said, because of your HIV condition, this cancer will spread. So what the doctor is saying is just okay, but anyway, the way he did it was wrong. He could have at least taken you through counseling before breaking the news. But yes, this is the right step to do.
So you had to worry about the HIV and the cancer as well?
HIV didn't worry me much because I was already on treatment. I had managed it well.
Yes.
But now the fact that my womb was going to be removed and I've already lost 2 babies and I won't have more, that really shocked me.
Right.
And I'd seen many people dying of cancer. So for me, I just knew.
This is 2007. We're in 2019. Here you are seated.
Yes.
Looking healthy. How did having cancer, and I use past tense, how did having cancer change your life? Did you have to make changes financially, socially? Did you have to cut out a few friends, spiritually? How did having cancer change your life?
In one word, I would say it has humbled me. Yes. The pain has humbled me, and also getting to know who are the true friends, who are the true relatives, who are the true people you can depend on. And I'm humbled because I must say that after the cervical cancer, it actually reoccurred again in the colon. And I can say that I've lost 3 of my body organs. So I had total hysterectomy, and then it went to the colon. I lost part of my colon, and then the rectum.
And all this is because of cancer?
And all this is because of cancer.
What do you have there with you?
And now, as I say, I'm a survivor and a warrior for that matter. But I'm healed from cancer. I'm actually cured, and I'm here to tell Kenyans that not all cancer diagnosis equals death. I survived, and there are many others who have survived. But it left me with a disability, not visible though, but it is a disability. And I would like to ask a colleague here from NHIF if you cover these things that I'm having here today. Are they covered under NHIF? Now, what are called? These are called colostomy bags. So after I lost my rectum, there's a special passage that I use for passing stool through my body. So I have to use this, I have to cover it with this special bag that is just a colostomy bag. It's not available in this country. What we have here is this.
It's not available?
This is what we have available in the country.
Okay.
And if you compare it with these other ones, this is donations we get from overseas. And this is what we have in this country. But also getting it is not easy. Sometimes you might have the money and you don't get it. And I would say one of these would cost 300 Kenya shillings.
300?
Yes.
And how many do you use?
You see, like it's a closed pouch. So I could even use 10 of this. The reason being that it has an adhesive here.
10 in a week?
In a day.
In a day.
Because this adhesive doesn't hold.
10 in a day, and that one costs
you
$300.
It's not as firm as this one.
Right.
Yes. So you can imagine how many Kenyans can afford this.
So Gilbert, is that covered?
Is that covered under NHI?
For the colostomy bag, currently, it is not, because it's not very many healthcare providers have stocked them in this country. Right. But for the other bag, we do cover. Yeah.
But maybe if I chip in and ask, check, maybe what NHIF would need to look at is covering all the rehabilitative devices and products, because these are rehabilitation products for people who've had colorectal surgery. So they need it for life.
So that should be included in the cover?
It should be included in the cover, so should prosthetic limbs. If a patient has cancers of the bone and they have to amputate their leg, you know, that means that patient needs a prosthetic leg to walk. A woman has had a breast removed. They need a prosthetic breast. It's part of rehabilitation, because a patient who is not well rehabilitated will go to depression, will have a lot of psychosocial distress. They'll keep seeking health care because of mental issues. So maybe to do very well if you take message to NHIF to cover cancer rehabilitation products, the whole range. And then we also get our KEMSA to stock good quality bags, because they can import. If these are coming from overseas, they can import for patients, stock good quality bags, and involve the users. Yes. Talk to Sally and all the patients. There are thousands in this country. Some are using juaras and diapers and all sorts of things which are really lower their dignity. So if any KEMSA can import good quality bags, talk to these people, and get them to know what does a good quality bag look like. Not
only just that, but the accessibility and availability of it. Because Sally, you're saying you can have the money today, but then they're not in stock.
They're not in stock.
How much is the one that you have to import?
This one ranges between 700 and 1,000 shillings.
700 to 1,000 bob.
Yes.
So, Dr. Alfred, does the treatment of cancer make it more difficult when someone has an uncommunicable disease as well?
Yes, of course, because for example, what he had mentioned about comorbidities or another disease that alongside cancer, of course, that will add onto the cost that is involved, because you'll have to take other medicines, to also manage the other condition. Let's say it's hypertension or diabetes. But I think there was a conversation about how would it vary? How would the cost of treatment vary? I think that is highly individualized, because largely when you talk about cancer treatment, there will be 3-4 main modalities that you're talking about. A patient will either require chemotherapy, radiotherapy, surgery, or some form of targeted therapy, sometimes immunotherapy or some other forms of targeted therapy. Now, I think depending on that's why I'm saying it depends on the individual condition of the patient, because it depends on things like, the stage in which the condition is detected, the individual characteristics of that patient in terms of, male and female, what desires you are trying. Are you trying to like for her case, when she's talking about, she had cervical cancer and she desired to, still, maybe you may have desire to still have, children in the future. Right. So that's why I'm saying the number of variations that
depending with that person.
Yes. So, but in many cases, a patient will require a combination of those things. So many times you will see a patient will require surgery to remove the diseased part of the diseased organ, chemotherapy, and so commonly you will see a patient requiring a combination of those three. So that then drives the cost. And then again, also we need to realize that there are both the direct costs and the indirect costs, because if a patient has to travel, the patient is coming from Butere or from Kitui to come and access radiotherapy at Kenyatta National Hospital. Other than the cost of the actual radiotherapy that they get, they need to think about, how do I travel from Kitui to Nairobi?
And
where do I spend?
Right.
Yes. So
devolution is still pretty young, still a young baby.
Yes.
But what, from the ground, from where you are, and you just brought it up, what would you want to see devolution doing in terms for cancer patients? Not that have been so specific, cancer patients. Do I have to come all the way from Wajir to receive treatment?
And we are working with the county governments, because what we appreciate is that at different levels, something can be done at different levels. For instance, patient follow-up and patient support is possible. There's a whole concept of palliative care that includes, pain management, includes psychosocial support, includes rehabilitative care. Those are some of the services that can comfortably be provided at the lower level, so that we leave the fairly specialized services like your radiotherapy, your chemotherapy. A patient could come and access the specialized services at a central level, but can continue the supportive care at the county level. So, if I were to specifically address your question, the county governments can invest in some of this supportive care, so that the patient does not have to come for the what we call the definitive treatment in Nairobi and still come for supportive treatment in Nairobi. They should be able to provide some of these services. Your nutrition support, some of the patients will require even, blood transfusions every so often. So that some of these services are within the capacity of the devolved, states. And even some of the specific treatments. And that's why our CS talked about, in the past 1 year, we have set about 9 chemotherapy units. Because you don't need to travel from Bungoma to come to Kenyatta National Hospital to get chemotherapy.
So then, Dr. help me understand this misdiagnosis, which has been a cause also to one's pocket.
Yes.
Why are we seeing misdiagnosis such a popular thing when it comes to cancer? Is it we have very qualified doctors, so is it a matter of negligence? Why?
I wouldn't say. I would say it's how our health system has been shaped over the past.
Okay.
There has been resources seemingly have been more focused on communicable disease, because I think we were trying to manage what was the biggest burden over the years. HIV, malaria, and TB at some point were really a big problem in this country. So quite a lot of investment, because of trying to manage that. Inadvertently, I think quite a bit of investment went towards infectious, illnesses. So we could say that at some point, the non-communicable diseases were not as well prioritized as the infectious ones. So when you look at our health workers, they are not as well attuned to easily detecting cancer or hypertension as they are to detecting a patient. Any health worker in this country can quickly tell you, I suspect this is TB, I think this is malaria. But when it comes to something like cancer, then that becomes a bit more, they require a bit more training for them to be able to quickly also think about, so that cancer starts, featuring among them the options that they think could be a diagnosis.
Right.
But I think the other thing is that we also need to appreciate that cancer as well sometimes is not, some of the symptoms that cancer presents with are not very specific. I can give you an example of something like blood cancer, leukemia. You will have very vague signs and symptoms, things like just general fatigue, having fevers running on and off. So sometimes they can be confusing. So I think why sometimes it has appeared like misdiagnosis is because health workers have tended to go for what they know first, which is infectious illness. So you'll see patients being treated for typhoid repeatedly because the health worker is tuned to think that when you see these kind of symptoms, the most likely scenario is typhoid, or before they start thinking about something like stomach cancer or colon cancer. Yes.
So, David, one of the ways of mitigating the cost of treatment for cancer is support groups for survivors. It's one thing for you to go through cancer. It's another thing when it costs you millions to, just treat it. It's another thing when you don't have basic support system. In Kenya, do we have support groups for cancer patients and cancer survivors? How popular are they? Are Kenyans willing to sit in a circle like this and sort of share the stories to help them with their journey?
Yeah, we do have support groups in this country. Some are hospital-based, others are community-based, because there are different types of support groups. Some serve a very specific population, where you find people with colorectal cancer, for example, have a support group like Sari and her group. There are others which serve maybe parents of children whose children have had cancer, so a parents kind of support group. There are others who serve just about everyone, which may be a very generic group. So whether they are men, women, any type of cancer, they would meet typically every 2 weeks or every 4 weeks to share their journey and help each other in terms of how are you coping, what are the tricks of getting through, whether it's diet, getting through chemotherapy, what lessons have you learned. So they play a very, very important role, and if they're actually part of the continuum of treatment, because typically, if a patient is diagnosed with cancer, they probably think they're the only ones. They've never met anyone who have had cancer, or they always hear these things vaguely. So when it affects them, the one thing they want to connect with is a group of people who've walked that journey.
And speaking of which, Sally, how have you then managed your finances? Since 2007, when the doctor broke the news to you, how did you manage your finances?
I must say that I was privileged because I was working for an organization that had a very good medical cover. So they could pay the cover and, of course, NHIF. And if it went overboard, then they would even chip in. So I would say that I was privileged then. If it happens to me now, I don't know what I would do, because I can't even afford to pay my NHIF right now.
Speaking of NHIF, Gilbert, what is NHIF doing to make sure that they caution Kenyans from high costs of treatment for cancer? Is there anything that NHIF is doing?
Yes, NHIF is working overdrive to ensure that they caution Kenyans from out-of-pocket catastrophic expenditure. One of the things that we've done at NHIF is to strategically purchase healthcare services. Towards that end, we've engaged some pharmaceutical giants, and I want to salute Janssen Pharmaceuticals, whom we engaged, and we were able to reduce the cost of drugs for prostate cancer. There's a drug that they sell in the market known as abiraterone acetate, called Zytiga, which initially, when it was introduced in this market, was going for 250,000. But after negotiations with the Janssen Pharmaceuticals, we were able to reduce the cost by 60%. And it's available to our membership. The other thing that we are doing, we're also engaging like-minded institutions. To that extent, we are currently speaking with Novartis. They run a program called Access, whereby for 200 shillings, members can be able to get access to cancer drugs. We are talking of tamoxifen, leprozole, and others. 200 shillings per month. We are at the very tail end of those negotiations, and very soon we will be putting about 15 molecules, leave alone cancer, diabetes, hypertension, respiratory diseases, available to Kenyans. We are also talking with healthcare providers, and I gave you an example of Aga Khan Hospital, whereby we were able to negotiate the cost of the PET CT scan, which is used for diagnostic imaging, from a high cost of about 100,000 to 69,000. We are also in talks with other providers like Nairobi West, who have invested in the latest technology in the market known as Halcyon. We are looking into ways and means to caution Kenyans from out-of-pocket expenditure. We are also partnering with the national government through the health insurance subsidy program, whereby persons, older persons, people with severe disabilities, orphans, are able to be registered through the national government.
Information is key.
Yeah.
David, we need to take a quick commercial break, but I can tell you have a point you'd like to...
Yes, I think what the initiative NHIF is taking certainly very, very commendable, but I think we need, from civil society and representing patients groups, we need to change the whole structure of how they do business. I think all these medicines, dawas for cancer, should be handled by KEMSA, 100%. Let KEMSA do bulk purchase, negotiate with industry and everyone else, and then make sure that all cancer service providers are getting the dawas from KEMSA, because there's advantage of bulk economics of scale. Right. So the benefit will ultimately go to the patient. Right. So then again, we also make it less complicated. Some patients don't know which is complex chemo, which is simple, which is what. Let a Kenyan who has an NHIF card access screening, because we must start there, access treatment on the basis of your NHIF card. It will cost some money, but cancer is a big problem that is capable of bringing down our economy. So we need to just get to a place where I have a card, I go and get treatment, 100%, so no questions
also
asked.
How fast it is done.
Yes.
Okay, great. Let's take a look at your feedback on SMS and on our Twitter handle at Citizen TV Kenya. That's our official handle. The hashtag Daybreak is your ticket into the conversation. Tamurai, you say the government should invest more in equipment and personnel. People should be taught more about cancer, since with the early detection, treatment is cheaper. If discovered in late stages, it's expensive. All right, still sticking to Twitter. Cost of healthcare, more specifically on cancer, is our conversation this morning. Kizito, you say this NHIF coverage is a fog. I am in Mombasa, Aga Khan, and lately Lighthouse. I need a biopsy rather, and at the moment the receptionist kept insisting that NHIF only covers civil servants. How come I only pay 100,000 a month? Gilbert, is it?
No, we do cover cancer treatment comprehensively.
I'll give you a chance to answer to that one. Let's listen to John. John, you say, I just wish the government would drop all the other agendas and deal with health and do it perfectly. Not just Bora Huduma, but Huduma Bora. All right, SMS 22422 before we get Gilbert's thoughts on that question from one of the viewers. Patrick from Nyeri, you said government should open up centers for this disaster. Why is the government allocating money, e.g. to luxury projects like the SGR rather than basic projects like health? And you continue to say that secondly, the government is caring for cancer victims who are state officers instead of sensitizing the young generation and the entire Kenya on dangers of cancer. The government should care for 14 million Kenyans, not few popular citizens. All right, still on SMS 22422. That's where you can put in your thoughts and share it with us. John from Hobart Bay, good morning. You say, would it be possible for the government to have a policy framework for cancer prioritized equipment of model cancer centers with about 2% of our annual financial budget, 70% of EACC recoveries, and 20% local revenue per county? All right, going into the framework of cancer. Rose, you say cancer is a major public problem globally and in Kenya. The health sector should incorporate screening as part of routine checkup when patients seek any medical service. David, what you've just said has been echoed. Let's take a look at the last one on SMS. Tina, you don't say where you're watching from. Good morning. You say that the gentleman from NHIF should be more sincere. The chemo cover is very limited. They only cover 6 sessions, yet I had 16 sessions. Why can't this be the case? All right. Why can it be case by case? All right, so Gilbert, we'll give you a chance to answer to those comments when we come back from the commercial break.
Okay.
So let's do that. Let's take a breather and come back with closing comments. Stay with us.